What are the downsides? What are the problems that are associated with the performance of IVF? Well, first of all, no one could argue that when you go through a procedure where needles are involved, injections are required, and you introduce needles into the ovary to remove eggs, that there's a pain element involved. Pain is definitely a factor, but it can be mitigated through using the right process, the right technique, and with appropriate counseling in advance. Pain is definitely a factor. Nobody can argue that point. But the reward is also great. So you've got to weigh up the cost and the benefit. The second downside is that in vitro fertilization is expensive. Nobody can argue that. But I always tell people to ask themselves the question, are we talking about the cost of a procedure or the cost of having a baby? If you look at it as the cost of having a baby, then if you do IVF, then you get the baby faster than you would with other alternative procedures such as IUI. And so it's the cost of a baby that matters, not the cost of a procedure, because if you have to do the procedure over and over again, it'll end up costing you more financially.